Edwin Chadwick was one of the first major health reformers in European history. Chadwick successfully discovered that there were more cases of disease where there were bad conditions.
Disease has become a huge problem in Britain. Everywhere I turn, I see another homeless person. Ma'am, why are you living on the streets?
I'm sick, so I can't work, and my husband, he died from cholera, so I have no money.
All this trash and human waste is a big problem in the city. I bet if we cleaned it up, there would be less sickness going around. The streets are so dirty and there's nowhere for it to go and nobody picks up the trash. I wonder how we could fix this. I bet we could get sewers to clean the streets. If we use running water in all parts of the cities, it would improve living conditions as a result. Less people would die and get diseases.
Chadwick's ideas were known as the sanitary idea, the idea that disease should be prevented by cleaning up the environment. In 1848, the General Board of Health was created under the Public Health Act as a result of an article that Chadwick published.
This cholera epidemic has gotten out of hand. We've had 60,000 deaths, and it can't continue to happen. Have the local boards of health been set up?
Since we can't make them unless there are a certain number of deaths or the citizens want a board, only a few have been. But those have elected their surveyors, inspector of nuisances, treasurers, clerks, and officers of health.
What clauses have the Public Health Act started?
There's the cleansing of sewers, sanitation of houses, supervision of lodging houses and slaughterhouses, and the maintenance of pavement.
In 1858, this board was replaced by the Local Government Act. Regarding their citizens' health, governments began to take some responsibility, and as a result, in the mid to late 1800s, public health began to rise. The miasmatic theory is the belief that people become infected with diseases when they breathe the bad odors of trash and human waste. This belief limited the capabilities of Chadwick. It wasn't until the 1840s and 50s that they discovered that disease was transmitted through trash and not caused by it.
Louis Pasteur was a French chemist who, while researching fermentation, developed the germ theory. With this, he discovered that specific diseases were caused by specific living organisms, or germs. He also discovered that these germs could be controlled.
Robert Koch was a German doctor who found cultures of dangerous bacteria, including the cause of anthrax. This continued long after him, and scientists continued to find the organisms that caused different diseases. The creation of effective vaccines were a result of Koch's work. Joseph Lister was an English surgeon in the mid-1800s. He applied Pasteur's germ theory to his surgery and started sterilizing gauze and later surgical instruments. This is now known as Lister's antiseptic principle, and it decreased the rate of death by infection after surgery. This practice was later improved in Germany when they not only sterilized the wound and instruments, but everything that went into the operating room.